Hi, you've just returned home after undergoing surgery for one or possibly two trigger fingers. I would like for you to take a few minutes to watch these post-operative instructions to ensure you have a smooth and quick recovery. Surgical pain is often described as mild. However, as pain tolerance varies highly from one person to another, you can manage your own discomfort using the following pain medications: Tylenol, ibuprofen, or narcotics such as oxycodone. You may combine them as long as you respect their maximum dosage. You should always check with your pharmacist for interactions and contraindications. Our goal is to prevent the pain before it starts. Keeping it under control is essential to be able to participate actively in your recovery. You should stop taking your prescribed narcotic pain medication as quickly as possible to avoid possible side effects such as constipation or nausea. You should never drive while taking narcotics. These exercises can help you relieve discomfort after surgery. Raise your hand, or both hands if you've had bilateral surgery, above heart level to help promote venous drainage and reduce swelling. Elevate your arm completely over your head to help minimize swelling faster. Repeat a few times every day for the first 4 or 5 days. You may apply ice on the surgical area. Use a cloth or a Ziploc bag and apply for 15 minutes at each time to avoid burning your skin. The surgical dressing covering the incision can be removed the day after surgery. Keep the steri strips in place until your next visit. You may notice some dried blood under the surgical tape, which is perfectly normal. You can protect the wound with a Band-Aid for your comfort. You may shower the first day after surgery, but be cautious not to immerse your hand in water. Baths are permitted as long as you keep your hand dry for the first 2 to 3 days. The 2 small incisions should heal within 2 to 3 days. You must start exercising your wrist, hand, and fingers immediately after surgery. Your tendons have been released and we want to prevent adhesions. So as soon as you get home, you should move your fingers, hand and wrist to their fullest range of motion. Close and open your fist, making sure you extend your finger fully. Use the other hand to help. Repeat at least 10 times a day. These exercises might cause some discomfort. Do not hesitate to take your pain medication to ensure you do them properly. Do not use stress balls for the first 2 weeks as they're designed to help regain strength rather than mobility. Misuse of stress balls can lead to inflammation, which of course we want to avoid. Driving is permitted as soon as you stop taking your narcotics. Most patients can resume driving 1 or 2 days after surgery. When you may return to work depends on your occupation and how fast you recover. Don't forget to call to schedule your appointment 2 weeks after surgery. This visit is important to evaluate your progress and discuss your return to work and other activities. Until then, you should not hesitate to contact us if you develop a fever or notice unusual drainage or redness around the wound. I encourage you to call us at any time if you have questions or concerns. I look forward to seeing you again in 2 weeks.